Hi, I'm Dr. Angela Yeagley. Welcome to Sage Health TV. Today I want to talk about what is anti-aging medicine, also known as regenerative medicine. Most people, when they think of anti-aging, they think of cosmetic things, which it can be, topical agents that really help to heal your skin, at least the skin that people usually are seeing, right, your face. But it really goes deeper than that. If you really want true anti-aging, we have to think about the rest of the body, what's going on in the cells and the rest of the body. So there it comes back to, this is going to get a little sciencey for a second, but you've probably heard of mitochondria. They are little tiny organelles that actually live in your cells that create energy. So they create something called ATP and NAD and NADH. So now when those actually experience damage, that is the cause of aging. And so when we're looking at anti-aging, we have to think about how do we stop damage to the mitochondria, right? That's number one. And then how do we help them produce more ATP, more NAD, more NADH, so they can, because they're in every single cell in the body, so they can initiate a really nice aggressive repair of your cells. And again, that's everywhere in your brain, muscles, skin. So a really interesting study around this. So a university created a bunch of mice, they call them gene knockout mice, where when they gave these mice a medication, it started damaging their mitochondria. And within just a couple of months, the mice lost most of their hair, they had wrinkles, they started having arthritis that they could image. And so what was actually more fascinating though, is that when they took that drug away, so the mitochondria could then function normally, the mice grew back all their hair, the wrinkles went away, and the arthritis repaired itself. And so that's just a really basic look at it. It's okay, they're so important for us. And really, we now know that the earlier you can take care of your mitochondria, the better you're going to do in the long term. Although I will say it is never too late to start. It's never too late to go ahead and start making some healthy changes. So okay, so starting out, how do we help our mitochondria? I'm going to talk about some things that you have all definitely already heard of, but they are still very, very relevant. One, we want to have good sleep, keep our stress down, lots of water, have whole foods, lots of rainbow color on our plate, and also do some fasting or intermittent fasting. All those can help. And then what do we not want to do? We want to avoid smoking, we want to get mercury fillings out of our mouth. We want to make sure our house doesn't have any mold. You want to make sure that you're exposed to as little chemicals as possible, or at least protecting yourself if you have a job like that. And then also with foods, getting rid of your food allergies, not eating processed foods, taking away sugar. All of those things are going to help. And I do, again, we have so many other videos that kind of get into depth on a lot of these things. So definitely, if you're curious about any of those individual things, go and check out our YouTube channel. So what are the things, maybe bigger therapies we might look at if you wanted to support your mitochondria? Well, that's where we get into ozone therapy. It's a type of oxygen therapy that actually helps to heal your mitochondria, right? All of that additional type of oxygen. And so we do things we do it systemically through IV, we inject it into joints, it repairs tissue. Same thing with something called PRP is another style of regenerative medicine for joints, and tissue in general, platelet-rich plasma. And then getting into stem cells. So probably everybody now is starting to learn about stem cells and what they are. These are these fresh kind of baby cells that have, awesome brand new mitochondria. And so you could tell that they're really getting in there and driving, good healing. But say if there was something that you're okay, I know about the sleep, I know about the good food, I'm working on that, what else can I do? If you wanted to start something today, well, there's three things that I love. And if you're looking to help yourself in this way. So the first thing would be something called nicotinamide riboside. And what that does, it's actually a supplement. It's a form of B3 that helps to drive production of energy, NAD and NADH. So there are really good blends on this, and the research around this is fantastic for the healing of your cells, which again, we're thinking of, we are all made up of those cells, so it's going to help our, longer, if we're getting into looking at longevity, or just feeling better on many levels. The next one that I really love is glutathione. This is one of the strongest antioxidants we make in our body. It's called the master antioxidant or master regenerator. because it helps to regenerate other antioxidants. It actually participates in neuro regeneration, so heals the brain. You can take it as a supplement. Probably one of the, if you're really looking to make a big impact on your body, we really love IV glutathione because it really goes directly into the cells. And lastly, vitamin D3, active vitamin D, is probably one of the best things you can add in. And of course, making sure that you're not getting too much, so you always want to have it tested. But vitamin D has been studied, probably hundreds, if not thousands of studies on vitamin D that show how it actually turns on genes that protect you, as well as initiates repair throughout your body and your bones, and again in your brain. So absolutely find out what your level is and add this in, especially if you live where we live, which is Seattle. So that's pretty much for everybody. So thank you so much for joining me today. If you have any questions about anti-aging, we'd love to hear from you. Definitely give us a call, and we look forward to seeing you soon.